Are you somebody who has an extremity injury or has had one in the past, such as shoulder pain, fall on the outstretched arm and hand, an ankle injury, a hip injury, even with your jaw, a temporomandibular joint disorder? Pay attention to this workshop because this one is going to be just for you. So again, I'm Dr. Ryan Weaver here at Apex Spinal Performance. This is one of the biggest things that most people aren't aware that chiropractic care can help with are our extremities. And that's exactly what we're going to be talking about today. You heard me mention some of those and the 7 extremities that we really break these all down into. Number 1 being our jaw, and from there outward, our shoulders, our elbows, our wrists, our hips, our knees, and our ankles. So we're going to dive into a little bit about each one of these. Again, we're not going to get into a whole lot of specifics. I know we just covered ankle injuries not too long ago, but given this time of the year, with athletics starting back and kids in fall sports, and not to mention winter is not too far away, that ice happens and snow and we fall, and how we can actually help as chiropractic care. So the one that I'm going to start with first off, kind of like I mentioned a few weeks ago we talked about, is an inversion ankle sprain, and how this really affects the whole body is because as soon as we stand up, we're on our feet and our ankles. So thinking of that as our foundation, that can even play a role into issues with our knee and our hip. I can relate that to sciatic nerve pain, which is something we hear so often about anymore. But really understanding the mechanism of how this happens with our joints and our structure, then we can understand how to actually care for that and treat that. So in this example, most commonly an inversion sprain is when our ankle rolls to the outside, typically an eversion sprain where I'm probably going to fracture something, but that already moves our bones. A sprain by definition, you know, I give this example on our last workshop, 2 bones hold together by a ligament, and that stretching, by default, the bones had to shift. So that can irritate the surrounding tissue. That's why we get swelling and everything around there. It could be black and blue, but some of the diagnoses that we hear with that, tarsal tunnel syndrome, can be amplified from this. One of the most common ones that we see is that, and a lot of people don't know where to go or who to see for that, okay? Obviously, sprains and strains and other things along the way with that. But I'm gonna go ahead and jump up to our knee now, and when we think about how often do we sprain ankles, of course, some are way worse than others. In terms of grading scale, some you could actually fracture or tear tendons and ligaments, but how that affects the joint is the most important thing. So we're not going to get into the specifics of that. That is a lot longer conversation, but the torque and the torsion that happens in the ankle can torque the knee as well, and then we end up with knee issues. Patellar tendonitis, right? One of the most common ones that we see. That's going to then, therefore, affect our hip. And this is where we really get into how an ankle injury can affect our lower back and cause sciatica. So we look at that from the ground up. What's going on with our feet and ankles? What is that affecting and have an effect on our knee, into our hip? And we can even take that all the way up the rest of our spine, because then we just start compensating. So that's the way that we look and approach things such as lower back pain, and even all the way down through ankles, knees, and hips, which again is something that really gets overlooked in our profession, but also in our community, that patients aren't aware that chiropractic care can help with those things. So let's go ahead and jump up to our upper extremity, so our shoulders, our elbows, and our wrists. Again, you know, especially here in the Midwest, falls, especially during winter, you know, that can really irritate the front of the shoulder, which affects the musculature of that area, which can cause us to actually round forward. Now you hear this and see this a lot in my workshops, that we talk about forward head posture, where our shoulders round forward, and that's really going to irritate the joint space within the shoulder, and then we can end up with rotator cuff tendonitis, plus a whole lot of other things, bursitis, even tears, impingement syndromes, brachial plexus issues and injuries, numbness and tingling the rest of the way down the hand and arm. So we really need to, again, understand the mechanism of how that happened. Well, we can jam the wrist, we can jam our elbow into that shoulder, and again, that's not going to allow our body to move the way that it should. So we want to make sure that our symmetry and our posture is really upright, because anything deviating from that can cause some of those issues. Second thing, indoor elbow. Again, welcome to golf, tennis, pickleball. We see a lot of issues with that as well, where we have tendonitis on the outside, and that again can be irritated from a joint misalignment. Now, one of the biggest ones that is in our workforce, any which way, is carpal tunnel syndrome. So again, the carpal bones in there, all 8 of those again can misalign and put pressure on those nerves. You know, carpal tunnel surgery is one of the most unsuccessful surgeries. 20% success rate at best is what we see in some of the literature. So again, how can chiropractic care help with those things? Well, obviously, yes, we check the spine first and foremost, but then we need to take that down the line and say, well, is there an issue in the shoulder that can be affecting the wrist, or vice versa, and the elbow as well? You know, a lot of us look at, well, that numbness in our hand can be coming from a portion of our neck. That is true, but also it could be right in our elbow, our wrist, or our shoulder. So those are the full, you know, outward extremities that we look at. And the last one I want to talk about is our jaw. So temporomandibular joint disorder, TMJ disorder or syndrome. Again, there are 2 main facial nerves that come, or excuse me, main cranial nerves that come through there that can irritate jaw pain, ringing in the ears, locked jaw, and even affect us sleeping. So most importantly in research is that our neck affects our jaw and our jaw affects the neck. So we always want to make sure, you know, before even you get placed in a bite guard, maybe from your dentist, that we analyze your cervical spine, so your neck, and then also the alignment of the jaw. I'm not against bite guards, but we need to make sure that everything's where it should be to support that. So I just want to take a few minutes, touch on a little bit of each one of our extremities to give you some insight of how chiropractic care can help with those things. Again, I tried to cram a whole lot into very few minutes, but if anybody that you know suffers from those, or even yourself, or if you have further questions on that, feel free to contact our office and we can get you scheduled for a consult. But again, knowledge is power, and when you know other things that can help, and if you are sick and tired of going around and around the medical model of here's another pill, here's another pill, here's a surgery, and things like that, then definitely consider setting up a consultation. But I want to take a moment. I know this time of the year gets really busy with kids going back to school, and also the fairs are beginning, and sports as well. So I want to take a moment and wish all of our patients, all of our area and community individuals who are involved in the fair, who are involved in sports, wish you good luck. And you know, we hope to see you out in the future here at those fairs and at those events. I love going to go visit and watching those things. We did get a few informations about some of the fair, so I'm going to try to be out there in person, and Dr. Jake as well. So thank you guys for always being attentive and asking questions in the office and our community. So we look forward to seeing you at our next Spinal workshop. Take care and hope you have a blessed day.